I knew that it's important to make a difference on a daily basis as a nurse when you're working with patients. You know, I may have an impact on those 4 or 5 people I'm taking care of, but I feel like as a nurse faculty member, I get to impact just exponentially more people because I'm teaching students who will then go on to impact people's lives. And I'm doing research that will impact many patients' lives.
There's a great value in having a PhD to help us develop the science that underlies nursing practice. It will help us become better nurses, better practitioners. It will help increase benefits to the patients, improve their outcomes, and decrease healthcare costs along the way. So there's a great need for nurses to do the research to develop the science that underlies healthcare.
Having a PhD really provides you with all of the skills, the knowledge, and I think the motivation to really understand which questions to ask to improve healthcare, and then really how to design studies that address not only the deficiencies in current care, but resolve those deficiencies and send people in the right direction for future care, so we actually know how to improve care so that patient outcomes are improved.
My program of research is focused on improving patients' ability to self-manage, in this case, cardiovascular disease. I have a particular interest and focus on patients with heart failure, and within patients with heart failure, helping them improve their outcomes through nutrition. And so just helping them eat more wisely, and from that point of view, actually helping them live longer and live better lives.
My area of research has really concentrated on improving outcomes in heart failure patients, and the outcomes that I'm talking about are quality of life, but also death and rehospitalization. And those are the outcomes that are of interest to physicians, to all healthcare providers, to Medicare, to policymakers. My approach is to concentrate on biobehavioral interventions, so interventions that pay attention to things like depression, lack of social support, inability to engage in self-care. And all of those things are really the important issues that nurses can deal with and do wonderful research.
I'm very interested in the family caregivers' burden, their stress and their quality of life. And patients with heart failure experience a lot of the distress and also especially depression, but caregivers also experience the depression and distress because of their caregiving role.
I do research on the link between depression and heart disease, and I'm really interested in what nurses can do at the bedside of patients with heart failure who are depressed, seeing if things that nurses do can make a difference in their outcomes.
My research program is focused on care of the critically ill patient. I focus on improving both pulmonary and cardiovascular function in patients who require mechanical ventilation so that we can have optimal outcomes like early weaning without complication, without cardiac arrest or acute myocardial infarction.
Nurses are particularly good at putting it all together and looking at the whole patient. So when we collaborate with other researchers, that really helps us do that because they come with their perspectives. We put all that together and we have a good full understanding of how all these things interact with each other in the patient's life.
It's a great team because they're really well respected and are internationally known. And just to be able to surround yourself with a team like that is very helpful in just helping, me grow personally and professionally.
I actually have had several PhD students here who have functioned as research associates for my studies. What I really enjoy is actually mentoring students and new faculty and helping them develop their programs and their approach to answering questions, important questions about patients. And when I see them, have a publication or do really well with the presentation, then that's my reward.
I have a really strong commitment toward helping students be successful because my mentor, the person who was my advisor in my PhD program, was so fabulous at helping me see the many, endless opportunities that are available in your chosen area. And I really blossomed as an academic, as a researcher, as a scholar under her mentorship, and I love to provide that for other students.
We offer students that work with us the opportunity to get hands-on research experience, to get fully involved, to learn all aspects of the research process, and then to also enjoy the benefits of seeing how this research makes a difference in patients' lives. So I think they get the reward of seeing that what we're doing makes a difference and what they're doing makes a difference.
I think you can't beat the mentorship here. You have a lot of senior scientists who have a lot of NIH funding who are really willing and excited to support new PhD students and mentor them. And then you've also got a lot of junior faculty too who know what it's like, who have just been there. And so I think you really get great mentorship at the University of Kentucky.
Faculty members always encourage students to go to the conference, to learn more, to give a presentation there. So when I just started my PhD program, I had a chance to give a presentation in American Heart Association conference. And it's really amazing because I was an international student and my English was not that great, but the Dr. Moser and the research team helped me how to analyze data and how to look at the things, and so it's so amazing.
If I hadn't worked with them, perhaps I would have been left looking in a book, reading about it, and while that's helpful, it's also helpful, to kind of be there with them, to ask those questions, get immediate feedback, and to really just learn from them.
And you also get the opportunity to publish your research findings while you're in school instead of waiting until after your dissertation. Because we have this thing called the manuscript option. Instead of publishing one long dissertation, you write a series of publishable papers, a minimum of 3. So I actually wrote 5 papers for my dissertation, and by the time I graduated, 4 of them were published or accepted for publication. You feel like you get a head start over other PhD graduates because by the time you graduate, you've already turned your dissertation into something that's published and that's impacting the field.
I would really challenge anybody to pursue a PhD, to have the flexibility, the unlimited joy about having a fabulous job that lets you really make a difference in people's lives at all levels.
And I just love the joy of also working with students and helping them, seeing them develop, and then watching them graduate and go on to careers that are highly successful. So that's greatly rewarding as well.
Nurses have been devoted to improving the lives of patients and their families, and I think this is the optimal way to do that. We do it at the bedside when we're providing care, but this is just a higher level way of doing that and reaching more patients.